Imagine a ligament in the elbow, no thicker than 3 credit cards, bearing the brunt force of a 100-mile-an-hour fastball. This is honestly the reality for baseball pitchers, or their ulnar collateral ligament, or UCL. And despite its critical role, the UCL is just not built for the extreme stress, often leading to one outcome: Tommy John surgery. So today we're diving deep into the anatomy, biomechanics, and to just how fragile the UCL is that leads so many pitchers to this type of surgery. What's up, guys? If you're new here or you don't know me, my name is Dr. Cam and I'm a double fellow and residency trained sports, orthopedic, spine, and manual physical therapist, as well as a faculty member in a doctorate of physical therapy program. And on this channel, I do provide strategies and tools to get you to throw hard and ultimately stay healthy. First, let's get a clear picture of the UCL structure. This ligament is a triangular band of connective tissue that connects the humerus or upper arm bone to the ulna, which is one of the forearm bones. Located on the inside of the elbow, it acts as a primary stabilizer during the high stress motion of a pitch. But despite its critical role, the UCL is fragile, measuring just 1.5 to 2 centimeters in length and no wider than a pencil eraser. Now, considering the biomechanical challenges the UCL faces with each pitch, while it can withstand about 32 Newton meters of torque, the actual force exerted by a single pitch can be upwards of 50 Newton meters. This substantial overload on such a small structure is a biomechanical mismatch that predisposes pitchers to frequent injuries. The repetitive nature of pitching exacerbates this risk. Each throw slightly degrades the UCL, inflicting micro tears that accumulate over time. And these tears gradually weaken the ligament, further diminishing its ability to stabilize the elbow under extreme velocities, which today's pitchers all the time exceed or often top speeds of 95 miles an hour or more. Critical factor in the UCL's vulnerability is its poor blood supply, particularly in the distal portion of the ligament. Distal refers to the part closer to the wrist. This limited blood flow severely hinders the UCL's ability to repair and regenerate, often enduring routine stress, slowing recovery processes and increasing the likelihood of chronic degradation and eventual failure. That's why guys who get a proximal UCL partial tear or sprain are better off to go through conservative treatment such as physical therapy with me than a distal tear. Given these factors, Tommy John surgery, which involves replacing the damaged UCL with a tendon graft from another part of your body, sometimes the wrist or the hamstring or the adductor, often becomes inevitable. This procedure has become a lifeline for so many athletes, allowing them to return to competitive pitching after a recovery and a rehab period that can last over a year. The UCL may be a small component of the body's complex musculoskeletal system, but its impact on baseball pitchers' career is monumental. As the sport continues to evolve, with pitchers throwing harder than ever, the role of the UCL and the biomechanical demands placed upon it must be a central consideration in both training and treatment strategies. And I honestly just want to thank you for watching, because this is a deep dive into the UCL and Tommy John surgery, and I hope it was very insightful. Please make sure to like, subscribe, and click that bell if you don't want to miss any of my content aimed at rehab, science, research, or keeping you at the top of your game so that you can throw hard and stay healthy. I'm Dr. Cam, and I got you.